רואים איזה שהן אינדיקציות גם לירידה בהגנה מפני תחלואה קשה, מפני אשפוזים?
שכאן בגל הדלטה אנחנו רואים, זאת התחלואה. זה לא, תראי, כשאנחנו מאשימים ממשלה או משהו כזה, צריך לראות. בוא תגיד עכשיו.
Dr. Tal Brosh. This discussion by the advisory board is only a recommendation. This recommendation was now given to the Ministry of Health. Now, the Ministry of Health will decide whether to adopt it or not and when to begin with that. Israel is quite good in delivering vaccines to the population, so I think once this decision will become operative, I assume within days or a week, we will ensue with this campaign, and hopefully a lot of people from the public will agree with that and come and get vaccinated. I think this decision is quite controversial, and it took some debate and a few meetings to reach this decision. It was not reached unanimously by the advisory teams. Public trust is very important here, and we know that a lot of people from the public, but also from the professional public, physicians, scientists, doubt the fact that giving a second booster right now is beneficial. The truth is, we do not know. We do not have any very good evidence to show that this intervention is beneficial. But we do think that science behind this decision is good. There is a good scientific background that supports this decision. We think that delaying this decision until we get more data could result in so many thousands of people getting infected, getting severe COVID, and dying before we get this data. Therefore, our risk-benefit calculation was towards deciding on giving a second booster right now. We see now that people who received the booster more than 4 months ago have about twice as much COVID infections than people who are very freshly boosted. So we do see some mild or moderate waning of this protection that wouldn't worry us so much if we were still dealing with the Delta. But now when we are looking on the Omicron, which we know that is much more vaccine resistant than previous variants, and we know that you need to have a much higher protection afforded by the vaccine to be protected from infection and from severe disease, we think that this waning might be very important and very detrimental to people who were boosted more than 4 months ago. This is the basis why we think that another dose right now will increase protection.
הוא משהו שהולך לאיבוד בכל העולם. זה לא רק אנחנו איבדנו, מסתכלים אחורה איפה אמון